Okay? Now, we need to know what cholesterol is in the first place. Its types. We need to know what lifestyle diseases are. But we're going to take this very fast. So in about 5 minutes, I'm going to talk about why we need supplementation. In about maybe 15 minutes or thereabout, we'll talk about what cholesterol is and the rest. Then we'll talk about possible ways to prevent and manage it. So you can see that the reason why we need natural pharmaceuticals to be unfolded when we understand what a disease is. A disease is an excess of something that is not needed, or a shortage of something that is needed, period. A typical example is if you have cholesterol, high cholesterol for instance, you see that we need cholesterol to survive. But when it is excess, we now talk about what? High blood cholesterol. And I'm opportune to have done a research on, in fact, I'm actually an authority in cardiovascular diseases. I mean, as a doctor of drugs and treatment, I also know that for every action, there's an equal and opposite what? Reaction. That's why you hear people say something like, you are what you consume, and so on and so forth. So as you can see, the supplements simply help us to achieve the desired opposite reaction. Because if disease as a result of shortage of something needed or excess of something unneeded, supplements are here to help us to achieve the desired opposite reaction. You can see that old man trying to run with his drip set. So, from basic principles, natural pharmaceuticals or supplements are packaged miracles that God potentiates to help us achieve our desired health goals. Simple. Does that make sense? Hence, they simply add the extra to ordinary to help us achieve extraordinary health objectives. A typical example will be the management of things, lifestyle diseases like hypertension and high blood cholesterol. If you were opportune to be in one of my seminars that had to do with hypertension, I explained clearly how in about 90 to 95% of cases, hypertension is as a result of blockage of blood vessels by mostly cholesterol aggregates. And once you begin to disperse this aggregate, blood flows freer. Then the heart needs lower pressure. And that is the origin of reversal of what? Hypertension. Because once the blockage is there, the blood finds it more difficult to flow. So your heart will have to compensate by increasing what? By increasing what? Pressure. And when that increase in pressure is sustained, that is the long and short of the story of what? Hypertension as a result of increasing peripheral resistance. So anything you do to clean up your blood vessels, or anything you do to reduce the need for your heart to pump with a higher pressure, will lead to a resultant decrease in blood pressure. And guess one of the major factors that block blood vessels? Cholesterol and its associates. So that means anything you do to make the cholesterol level go back to normal will definitely have a good impact on the overall blood pressure. Are we together? Yes. So this product is called RTC, for instance. There are many other alternatives in the company, but it's not available right now, but it will soon. I heard that it's not available right now, but I think it is, but I'm not sure. And you can see that it contains what is called eicosapentaenoic acid and docosahexaenoic acid. What these do is that they prevent cholesterol from what? Coming together in the blood vessels to block them. And they also help to dissipate the cholesterol. Among a lot of other things, it's these amazing essential fatty acids too. EPA and DHA. But the problem is getting the original thing. And that's why Forever Green products is very, very important. So now we understand why we need supplementation, right? We're not saying that you should let go of the prescription that you have been given. What we're saying is that you need these things for a lot of reasons we're going to see shortly. So let's just quickly run through cholesterol as a case study, high blood cholesterol as a case study. So generally, you can see that these natural pharmaceuticals contain a myriad of phytochemicals or molecules that assist us to achieve various health desires quicker and better. Well, just to be more specific, they help in skin conditions, weight management, they help to boost immunity, they help to resolve hormonal issues. You know that menopause is something that's a natural phenomenon that must happen to women. But it often comes with a tsunami of comorbidities or issues that have to be managed early. It's always better to hold yourself together as a woman when the tsunami of menopause comes than to allow the tsunami to wash or scatter the whole structure and then start picking the pieces when it is gone. That's why supplementation is also very, very super. Then bones and joint conditions, wound healing, eye condition. I have a couple of patients here, but for patient confidentiality reasons, won't be able to call them. If not, they would have told you personally what these things have helped them to achieve, and so on and so forth. But it's always good for us to have product knowledge. As you can see, my late dad, Igwe will say, what you know is easy and what you do not know is difficult. And that is just it. So that's that about that. The two greatest assassins on earth are cholesterol and stress. That is it. They kill the highest number of people on earth because cholesterol leads to cardiovascular issues, heart attack, stroke, fatty liver disease, and so on and so forth. Peripheral artery disease, peripheral neuropathy secondary to cholesterol blockage, blah, blah, blah. And you can see that it's very important that we take care of that. Yes, this is what it looks like. If you look closely here, you can see the cholesterol aggregates forming here and preventing the blood from what? Flowing. You can see some red blood cells are turning blue because of lack of what? Oxygen. This picture alone has explained everything we are saying. So when you take appropriate supplements or natural pharmaceuticals, they help you to dissolve these parts. We have drugs like for this, we'll see them shortly, but we'll know why we need supplementation too. This is actually what cholesterol looks like. But we have different types. But let us not think that cholesterol is so evil. It also has functions that are listed above. You can see cell membrane structure, hormone production, even the sex hormones that make us male and female. The one that gives the woman the hourglass shape and the one that gives the man the V shape. Cholesterol is involved in the production of those hormones. Vitamin D synthesis, the sunshine vitamin that you know, is from cholesterol. You can also see that the brain contains about 23% of all the cholesterol in the body. Yes. And not only that the cholesterol is present, it's not there for fancy. It's also used to insulate the nerve connections so that they don't spark or touch and begin to cause seizures or convulsions in people's bodies. There are something called oligodendrocytes. That's their basic function. You find them. You find them in the brain. The other ones are Schwann cells all over the body. They use cholesterol to produce that insulation. You can see that. So we can see that without cholesterol, someone can begin to have certain issues. self-green.
Natunobu.
I hope the lecture is going fine.
Yes.
Are we following?
Anything bad in
Because the cholesterol blocks the blood vessel. So what we need is something that will disperse or dislodge
all of them are
the blood
based on the
vessel.
same
You understand? In some cases, this cholesterol too can cause something like fatty liver disease. Because it's the liver that actually metabolizes or processes or produces cholesterol. About 80% of that is produced in the liver. So when the liver is strangled with excess cholesterol, when the liver is strangled with excess cholesterol, they start getting things like fatty liver disease. But you see, these lifestyle diseases, we are going to talk about them shortly. You see that they move together in gang. They move together, they follow each other. That means if one has a particular kind of lifestyle disease, it can lead to the others. So we'll talk about how they are interrelated, and eventually we'll round up with possible solutions to these problems. So I hope, does that make sense to us?
Yes.
Because everybody has cholesterol in their system. Everybody has cholesterol. But the problem is in what proportion. In fact, there are some components of cholesterol that should not be more than the others. Because once their ratio begins to get beyond a particular point, then there's a problem. I talked about a lady the last time that had a stroke when we were still talking. We'll get to that shortly. Yes, so where were we? Now we're talking about the brain having 23% of all the body's cholesterol. And you can see that that is very, very important with regards to what? Insulation of the nerves that conduct information. When these nerves are not well insulated, let's just say that they begin to spark. And that spark may lead to what? Seizures, forgetfulness, hallucinations, right? Or if the nerves themselves are not properly developed, you can now have intellectual disabilities like the one you find in autistic children, which is simply defined as a neurodevelopmental disorder that is characterized by poor communication, behavior, and all that. So you can see that even the vitamins, that vitamin A, D, E, and K are what? Causes of what? Cholesterol. So it's not as if it's totally bad, but it must have to be what? Optimal. Yes, you can see that it can even facilitate digestion and absorption of what? Vitamin A, D, E, K is written over there as well. So this is how it is made in different portions. This is how it's available in different portions in the body, the liver, the erythrocytes, that's the enterocytes, the intestines, even the kidneys and all that, all have a role to play in production. This is for the science inclined people, this is how it is made. But why I usually put this is because these red dots here, the tablets you see here, are the statins. Atorvastatin, simvastatin, rosuvastatin, victoriastatin, norkistatin, uzostatin, idigostatin. All of them are involved in blocking the production of what? Cholesterol. Especially from one thing that we all enjoy in Nigeria, starch, carbohydrates, ice cream. We'll talk about that shortly. So you can see these are the different types of cholesterol. We have the good cholesterol or the high density lipoprotein. What it does is that it removes bad cholesterol from the flesh to the liver to be metabolized. We have the low density lipoprotein, that is the bad cholesterol. Then we have the very low density lipoprotein, that is the very bad cholesterol. These two are very bad boys. So lifestyle diseases are diseases that are associated with our lifestyle. And these are the kind of lifestyle that can lead to lifestyle diseases. As you can see, lack of exercise, whether it's alcoholism, smoking, and so on and so forth. Lack of rest and all that. Anything that affects life, that's any negative or bad kind of lifestyle can lead to lifestyle disease. You can see that this one is very, very close to its maker, probably because of lifestyle, bad lifestyle choices. One of the lifestyle diseases happen to be what? High blood cholesterol, followed by things like type 2 diabetes, hypertension, yes, heart attack, ischemic stroke, All these things are offshoots that are interconnected with what? High blood cholesterol and others. They all move together. In fact, they form what they call a metabolic syndrome, where they have formed a Boraco meeting or a group meeting that they normally use to destroy people. That is just this. So prevention of these lifestyle diseases entails avoiding the avoidable risk factors. And lifestyle diseases, they move together. It's more like all for one and one for all. That is how they move. All for one and one for all. So one can cause many and many can cause one. That is it. So that's high blood cholesterol or hypercholesterolemia is simply excessive detrimental accumulation of every other form of cholesterol you know, apart from the good cholesterol. Does that make sense to us?
Yes.
So these are the symptoms, you know, apart from the hypertension and fatty liver disease that it causes. These are a few of the symptoms you see. Sometimes it has no symptoms at all, but you can see the mild fatigue, shortness of breath, dizziness, and that. Let's take note of this. Pale or yellowish skin. Some people have some kind of ring around the black part of their eyes. It's cholesterol that causes that. Some yellow patches that appear on the skin is actually a sign of high blood cholesterol in many cases. Swelling in the legs, confusion, memory loss, cognitive decline, pain or cramping in the legs. Somebody was talking about that not too long ago. So we say, I don't know why this leg is as if the remote control that is operating it is not working well. It's cholesterol that is blocking blood flow. Sometimes people have some kind of pain at the back here. Sometimes people sit down in an airplane for so long, they stand up, and a bit of that cholesterol breaks off and goes to block another place in the body, the person goes down again. Then they see that their villagers have shot and arrow. But it was just cholesterol. It was not their villagers, and so on and so forth. Okay, just a moment. So let us call this, you know, as we have our speedometer, let us call this our cholesterolometer. And you can see that this person is already accelerating all the way from good cholesterol down to bad cholesterol, because he's sleeping in Chicken Republic, Mr. Biggs, eating pizza, shawarma, gari, fufu, eba in the morning for breakfast, rinses his face with Coca-Cola and Fanta, and all those things are helping the person to accelerate down towards bad cholesterol. These are the causes and risk factors. Genetic predisposition. It is not genetic sentence. Some people believe that everybody in their village has cholesterol they must have. It's a lifestyle disease. It's a choice. If you eat what they were eating and live the way they were living, cholesterol is already your tenant waiting for you to collect rent. Then unhealthy diet, obesity, physical inactivity, smoking, and all the way down to who? Menopause. Once women begin to get towards the point of menopause, the rate at which their body burns off fatty substances like cholesterol begins to go. You see that fat begins to tie WWF belts around their stomach like this. You understand? You know that who used to watch WrestleMania is to now come and give them championship belts, title, and that is fat. You understand? And they'll be wondering why the fat is not going anywhere. So you need to also be conscious of that. But remember, prevention is better than what? Yeah. Once you see the fat as a visitor, please don't allow it to enter. Because one day these cells will divide into two. And those two will divide into two. And that is why the person's situation begins to get worse. Obesity comes in, and other lifestyle diseases that always come from other meeting with them will begin to follow. That is the problem. You can see that cat over there. This cat is an ambassador for high blood cholesterol. This is the commissioner for, this is the ambassador for high blood cholesterol to our bodies. And you can see the way it causes problem. Just look at him, you see that he's obese, takes a lot of alcohol. From the eyes you see he's smoking, he's overfeeding. Does this cat look like something that goes to farm? Doesn't do anything. In fact, you stay chairs early in the morning, 6 a.m. This is the kind of thing that leads to high blood cholesterol. You can see that somebody's heart and brain is crying, they are crying for help as a result of high blood cholesterol because it don't choke. It's too much, and that's why it may lead to all these problems. In fact, it also leads to kidney problems. People don't even know, and a lot of other issues like that. Sorry, we'll be a bit fast. You can keep your questions at the end, and we'll definitely get across to you. Okay? Okay, this is how it affects the eyes. You can see cataracts, you can see glaucoma, you can see, should I call it erectile dysfunction. This one is one of the major reasons, one of the major silent reasons of divorce in Nigeria. Nobody talks about that it was because of poor entanglement performance that they are in court. They will say he pressed toothpaste from the top, I pressed toothpaste from the bottom, that's what I fight. But it's actually the entanglement factor. The woman is always happy. When she's serving the man, the plate must always drop on the table with annoyance. You see, that is why most women that they are happy, go and investigate. You can't investigate, but if you could, you will see that they are happy in the other. So cholesterol is one of the reasons why that happens. Because it blocks flow to the entanglement facility and makes the owner of the entanglement arena very unhappy. Amen. Now, high blood cholesterol as one of the major enemies of the healthy heart. This is how it happens. You can see that it leads to overweight, giving the heart extra places to send blood to, so more pressure. You can see that it blocks blood flow, same issue. You can see that it blocks blood flow to the heart itself, killing the heart cells, causing that pain in the chest called angina pectoris that relates to the left hand, the jaw, and all that. Then you can see that it blocks supply to the nerves. The nerves, there are certain nerves in the heart called the pacemaker cells or the SA node. They're just like that DJ over there. They are the ones that regulate the beat of the heart. That's why you hear the But when cholesterol starves the SA cells of food, imagine not giving that DJ food for 10 days. You can start hearing that heart is already backing up because cholesterol has blocked supply to the cells that regulate heartbeats. Go and check people that have high blood cholesterol and diabetes type 2. Sometimes their heart will be beating normally. All of a sudden, it will be as if the heart kickstone when it was working. She started again. They will say, Jesus. This my landlord is at it again because I've not paid rent. I bent it now. You see, Africans always link things towards spiritual problems. When the physical problem is there looking at us, let us try to always seek medical attention. So this is how it destroys the liver. It comes and forms droplets, begins to strangle the liver and make the liver large. Then that's the characteristic right side pain people feel that they relate to this part of the shoulder here. That is what it is. This is how it blocks blood vessels in the entanglement facility and makes madam very unhappy in the other room. So sometimes we have to, this is how diagnosis is made, physical examination, family history, blood pressure and all that. Especially very innocent people. Then we have the triglycerides, the fatty substances and all that. But there's a link between their parameters. When you have the ratio of this one, the total cholesterol to the high, to the good cholesterol, be more than 3.4 to 1. Person is already at the risk of a lot of lifestyle diseases, including stroke, heart attack, and a lot of other things. Then when we have the total cholesterol to the triglyceride ratio greater than 1.5 to 1, you see that person is already at risk of what? Type 2 diabetes. So if you send this kind of result to me, and I look at it, I begin to press calculator, you'll be wondering, what was this guy calculating again? You understand? These are the things that I'm calculating to know your risk level and on the possible suggestion to give. So this is liver function test. This test to know how badly the cholesterol has damaged the liver. That's basically what it does. You can see the parameters over there. And you can see that 34.6% of Nigerians have high blood cholesterol. Can you imagine? And 44.1% have borderline. Please, how many of us are in this place now? If we are, that what this simply means is that if we are 100,000 here now, it means that let's call it 80% of people here are having cholesterol problems. Can you imagine? Do you see why this topic is important? But guess what? Nobody bother. People don't even bother to check. That challenge we have. And this guy is trying to do exercise now, but he didn't start early. So you can see that lifestyle modifications can also help with those ones there. Dietary changes like a Mediterranean diet is also very important. We'll see an example of that. Yes, but let's not forget that there are certain things, diseases that lead to high blood cholesterol. A simple example is what? Type 2 diabetes. Excessive consumption of alcohol as well. These two directly increase bad cholesterol. As you are swallowing it, bad cholesterol is coming out directly. Others will be indirectly, but these two do that. And a lot of other issues like that. You see exercise and all that are also not left out. So management and treatment is actually treatable. That is the funny thing about it. But the choice is what? If you determine to have it treated, it will leave you forever. It will never come back. But guess what? Everybody is at risk of having high blood cholesterol, depending on their life. Lifestyle. So regular physical activity, 150 minutes per week. That means at least about 25 minutes of exercise per day can save somebody from having high blood cholesterol. And you can see that you have to maintain a weight with a body mass index of 18.5 to 24.9. I've had patients that have body mass index of 53. That is, if we multiply the maximum by 2. They still have jara, and then they come with a myriad of lifestyle diseases. So I always tell them the truth. It's painful, but you must have to bring your body mass index back to normal. And many of them, when they obey, all these things just disappear. They vanish. They have to manage stress, healthy diet, like Mediterranean diet, you see that shortly. And then chemical intervention or medications like the statins and the others we talked about earlier. Surgery for people that cholesterol has finally strangulated their liver to a standstill. Then of course monitoring and follow up and all that. So these are the challenges involved. Late detection, you go. You understand? Self-medication, Sabinus, that pain on the right side of the tummy or abdomen may be as a result of high blood cholesterol strangling the liver. Then poor health infrastructure, low insurance, lack of trained health practitioners. Many health practitioners are here, but their spirit are abroad. So if you are talking to a health practitioner, you will be talking to an empty can of human being. So one has to be very careful. Economic challenges as well, poor health information and awareness systems. So people don't even know what is high blood cholesterol. I know a patient that has stroke in Abuja, a health practitioner. He said that he never knew anything about anything called high blood cholesterol, talk less of knowing where to start treating it from. If he knew, he would have had stroke in his 30s or so. He's a politician. And you may know him. Fake medication, depression, drug side effects. These statins people chew like chin will know what it does. And then poverty and high cost of treatment, chemical drug side effects, etc. These are challenges that make people tired. Well, of course, we know that old habits die hard. That's what they say, a fool at 40 is a fool for. It simply means that once you cross a particular age, to drop certain habits like smoking, excessive drinking, and all that can be a problem. You understand? That's also a challenge. Okay, these are a few of the chemical drugs. Of course, you see the statins over there, bile acid sequestrants, all the way down. These are the kind of things we use when patients come around. Yes, and these are their side effects. These parts you will never notice easily. They are written in tiny, tiny letters. Have you noticed it? Because if it's written boldly, nobody will buy them. So you can see that these statins put you like chin-chin, even cause a lot of abdominal pain, constipation, headache, muscle weakness, everything is there. But guess what? Sometimes people are stuck between the devil and the deep blue. Just have to find a way to bring them out of danger first. And that's why we give these chemical drugs. They are not to be used carelessly. Follow strict instruction of the prescriptions as they are given, because all drugs are poison. So this is why natural pharmaceuticals are important in the management of what? High blood cholesterol. Number one, they prevent high blood cholesterol in the first place. Then they improve lipid profile, resolve other lifestyle diseases that are risk factors like what? Type 2 diabetes. They help, they assist. Bear in mind that this is sugar and throw your metformin inside was known. If one has type 2 diabetes, follow the instruction and to be tapered off according to how your health practitioner thinks it. Then you can see that it helps to regenerate and rejuvenate damaged body tissue due to ischemia, that's blockage by high blood cholesterol. Prevent and resolve inflammation, remove free radicals that damage DNA, detoxify the liver, that is the major metabolic organ, the major organ that metabolizes cholesterol in the body. 80% is produced from the liver. So you see how important this is. Of course, they support gut health and digestion, and they tackle other issues that may follow high blood cholesterol the way as should be follow the bride in traditional wedding. That is high blood. Amen. So these are a few examples. We are not saying that you must use these products, but we are saying that this is what like I use for my patients and I get good results to assist. Now let's focus on the active ingredients. This contains what is called coenzyme Q10 and some other things here that help to counter high blood cholesterol, regenerate and rejuvenate the heart, the lungs, liver and kidney, supply energy to the mitochondria, and helps assist in treatment of hypertension and so on and so forth. Okay? So as usual, let's focus on the active ingredients. You can see this garlic and thyme extract with lecithin do these ones here too. This is an amazing product. We talked about it earlier. You can see what it does, right? That was Actic C. This is Lycium Plus. It's a very powerful antioxidant from goji berries. Protects the cells that are affected by high blood cholesterol. You can see that over there and more.
That one there.
Yes.
This last one.
Do you know that high blood cholesterol can affect the eyes?
Yes.
It can block the blood vessel that supplies the eyes, and somebody will be seeing the elder brother and be calling the name of the younger brother because it's not clear. You understand? But when you take things that will clear the blood vessels, the eye becomes what? And you start singing, I can see clearly now. Sometimes just playful like that. So that's that. And then this is Ag Plus, an amazing product. But I'll tell us about fiber. Do we know that fiber helps to mitigate high blood cholesterol? From where? The gut. It brings down, that is why you see that refined carbohydrates have been stripped off their fiber. And that is why it is one-on-one with your bloodstream and leading towards high blood cholesterol. This is an amazing product because it leads to nitric oxide that expands blood vessels that have been blocked by high blood cholesterol. It helps to do that. Hence, there's better supply to those areas. But guess what? As it helps blood supply to the upstream sector, it also helps blood supply to the downstream sector. Amen? So, the man's entanglement facility begins to perform better. And guess what? In patients that have stroke already, you know that the muscles of the body begin to wither off when they are not being used. This is an amino acid that will begin to build those muscles and prevent them from getting what? Withered off. So when people are doing their physiotherapy, this is also very important as well. We have a lot of these things, and we have other, even if it's not available, we have other things that contain what it contains. Wonderful. Please, we cannot talk about this thing today because the uses are numerously numerous. Who knows about this product here? Please up your hand. Somebody is even raising up the product. Wonderful. So you can see that it contains all these things, but amazingly, it's a somatic stem cell stimulant. I know a lot of us have been hearing about stem cell therapy. You pour under your tongue, you pour in your throat, pour in your stomach, pour in your head, everything. All those things are not real. They are fake. I'm a scientist. You cannot take stem cells under your tongue. The sublingual area under your tongue is made up of cells too. So how will the cells cross through cells? You cannot also swallow it because your stomach contains an acid that can dissolve iron called hydrochloric acid. It will decimate the stem cells. We may get there in the future, but the only place you find stem cells are in your bone, marrow, and maybe one or two other places, because that's what differentiates to produce blood for you and blood components. The rest you find in your body are mostly somatic stem cells. Those are the ones that repair your body when it's damaged. And this here is a somatic stem cell stimulant. So it's a general repairer of your body. Amen? You know, we've been talking about obesity, but I never told you guys that obesity is a lifestyle disease today. Have I mentioned it? So when you see somebody that is obese, the person is having a lifestyle disease. Some people have pot belly. You see, I'm praying to God that my own does not go beyond this, but I'm trying to push it backwards. We're still fighting, we're working on it. As you can see, because I don't want to be obese because I know it's a disease. Do you understand? And it leads to what? High blood cholesterol, type 2 diabetes, hypertension, fatty liver disease. It can lead to stroke, heart attack, angina pectoris. Just this obesity alone, infertility, eye problem. In fact, when it connects via type 2 diabetes, it can cause almost everything you know. Obesity that you take for granted. It's a lifestyle. So this is how we manage it. This is a Clean 9 program. It's a 9 days weight loss and detox program designed systematically to include dieting, exercise, as well as autophagy. Autophagy is not autophagy. I mentioned autophagy to one of my Yoruba lads. I say, autophagy. I'm a father. I say, no matter, it's not phagy. It's autophagy. But we just say autophagy in Nigeria. Oh, I said, in fact, it's the opposite of phagy because you will not eat. So that your body can have the chance to heal itself. This program gives your body the opportunity to convert this excess cholesterol, blocking the blood vessels, into useful materials. That is the job. Hence, when people start this program, oftentimes their blood pressure begins to go, sugar level begins to go, high blood cholesterol begins to go there, because your body is removing the cholesterol and converting it to something else. Because the body did not find any other thing to use. And you see that people that have fatty liver disease, the fatty liver disease begins to what? Because the liver begins to use the cholesterol that is disturbing it to produce better things, and the person begins to get rid of it. So you can see that because malnourishment means the cells will begin to become shriveled, and that's another problem. Because the cells will begin to lack nourishment as well. Does that make sense to us? But when use professional weight management like the C9 program, it will just go there and, in quotes, surgically remove the fat and leave the cells well nourished and happy. Does that make sense to us?
Yes.
So you can see why I mentioned that it removes fat deposits from the liver, heart, and peripheral blood vessels, and so on and so forth. Okay? So, ladies and gentlemen, at this juncture, I would like to leave us with this. 1, you are what you consume. And there's a thin line between factors, or let me say there's a battle between factors that destroy our bodies and factors that repair it. It's just there for us to be on the winning side. And please, you can see this man is not joking. Do not adjust medication and dosage without the guidance of a trained health practitioner. Sabinus, are you here? Please. And prevention is better than early detection. At this time, I will say thank you so much for listening and God bless.